Hi everybody, today I'm going to present my interactive case study on the drug Carbidopa. Carbidopa, or Lodocin is also its other name, is a dopamine promoter drug. This means that it actually is going to help the brain by promoting conditions of higher dopamine levels. Dopamine is like an essential neurotransmitter and hormone that causes actually neurological issues when it's not working properly. Carbidopa works to treat Parkinson's disease and symptoms that closely resemble Parkinson's disease, like uncontrollable shaking, stiffness, and like other mobility or movement issues. It is thought that a major cause of Parkinson's is the brain not producing enough of dopamine. Carbidopa must be used with a drug containing levodopa, and levodopa actually changes dopamine, or changes like into dopamine in the brain. And Carbidopa works on preventing the breakdown of levodopa so that it can enter the brain and produce more dopamine. There are hardly any side effects due to Carbidopa. If a person is experiencing any side effects or nausea, vomiting, dizziness, headache, it's more than likely due to that levodopa containing drug, not the Carbidopa. And so here I utilized the tool Chimera, where I was able to produce a bound structure of Carbidopa. The structure allows for its main function of being a decarboxylase inhibitor. The structure also does not enable it to enter the blood-brain barrier as well. Parkinson's disease is actually a neurological disorder of the brain, where the common symptoms are uncontrollable movements, like shaking, some stiffness, issues with balance and muscle coordination. Parkinson's disease appears to be linked to the breakdown of nerve cells in the basal ganglia. The basal ganglia nerve cells actually end up producing dopamine, and that's part of the cause on why the patients have issues with movement. Basal ganglia nerve cells is also kind of an area of the brain that does control movement. It is unknown on what causes these neurons to die. It also appears that the neurons, or that there is a mutation that causes Parkinson's, and it can be heritable. But environmental factors do appear to play a huge role on whether the person will develop the disease. So just because you had a family member that has it doesn't necessarily mean you will get it as well. The diagnosis does happen about 60 years old for most people, and the symptoms do appear gradually and subtly. And life expectancy is actually about 10 to 20 years after symptoms do appear. Parkinson's may also cause dementia. This is called Lewy body dementia, and this is a serious consequence of developing this disease. And so we're going to get kind of into how Carbidopa helps Parkinson's. And so levodopa is actually going to be converted into dopamine via enzymes called dopamine decarboxylases. But Carbidopa is an enzyme as well that's classified as a dopamine decarboxylase inhibitor. This is going to prevent the levodopa from being turned into dopamine. Until the levodopa crosses the blood-brain barrier, this function is going to be prohibited. Since Carbidopa can't cross that blood-brain barrier, the function of turning levodopa into dopamine is going to continue when the levodopa enters. There are important reasons to use both Carbidopa and levodopa in correcting dopamine levels. The dopamine cannot cross the blood-brain barrier, meaning levodopa can only be beneficial if the dopamine decarboxylase works on it when it has passed the blood-brain barrier. Since dopamine can't come in, you're going to want only dopamine obviously being in the central nervous system, not the peripheral. Levodopa, and there's also an issue with the gut. So if levodopa is present in the gut, it causes a lot of severe nausea, vomiting, and other issues. So we kind of want to prevent that from happening as well. So here's kind of a nice picture I found of how levodopa and Carbidopa work together. You can see that levodopa is prevented from turning into dopamine in the peripheral nervous system due to that presence of Carbidopa. Carbidopa will bind to that decarboxylase, or the DDC, preventing it from changing the levodopa in the peripheral nervous system. This means that levodopa is actually going to be left to enter the central nervous system, where then it can be turned into dopamine via the dopamine decarboxylase, or the thing that was prohibited earlier. The carbidopa cannot follow it into the brain, so it's not going to impact anything over there. And yeah, so it's not going to impact anything in the central nervous system just because it can't get over there, but it's going to prevent all of that dopamine being created in the peripheral nervous system where it's not going to do any good. And so X-ray crystallography actually is going to determine the molecular and atomic structure of a crystal via the deflection of X-ray beams on like the crystal. The nice part about this technique is that many different types of structures can form crystals, including like salts, minerals, metals, and even biological molecules like proteins. It is a very like applicable technique across a wide variety of compounds, which is why it's so nice. And how does this relate back to carbidopa? It's that in 2001, the carbidopa complex was actually discovered in that active site of that decarboxylase enzyme that we were talking about, on how it binds it and doesn't allow it to work. And it was discovered via crystallography, X-ray crystallography. X-ray crystallography does occur through 4 steps. And I have a really nice picture here outlining these steps. The first step is crystallizing that protein, or making it into a crystal that the X-ray beams can like deflect across. And the second step is producing a diffraction pattern, which shows parts of the crystal that absorbed the X-ray diffraction. So it's going to show like where it was absorbed. And that third step is going to be analyzing that and creating an electron density map, so you can see what the electrons are most dense. And then that last step is going to be determine the protein's structure. That's going to involve a lot of complex math, and this is usually done through computer programs. And so where are we on like Parkinson's treatment? Well, today levodopa and carbidopa are still the main treatment option of Parkinson's. It's important to note that someone must tell their doctor when they wish to stop using levodopa, because it can have severe and fatal side effects when they're stopped abruptly. These can be coupled to other like enzyme inhibitors that work to slow the degradation of dopamine in the brain, so increasing the dopamine in the brain eventually. And these are like the MAO-B inhibitors and COMT inhibitors. There are several other like non-medicated treatments that are used for people who don't like medicine or refuse to take it. And that could be like deep brain stimulation. That can surgically place electrodes into the brain, connecting to like electrical devices in the chest. So this will control movement, often getting rid of like the Parkinson-like symptoms. But there are even like calmer and less intrusive options like physical therapy, speech therapy, and even massage therapy has shown to work. And here are my references. Thank you.